Hello, I will be mimicking the vital signs. Um, so yeah, before I would start, I would enter the room. I would introduce myself to the patient, say, hi, my name is Clark-Reyes. I'm a nurse. I'm your RN for the evening. Before we begin, would you kindly just verify your name and date of birth? I'll verify that. He'd give me his name and date of birth. I'll verify it with the wristband. I'll then explain to him the procedure. Okay, so today we're going to do your vital signs, and that includes your temperature, pulse, respiratory rate, and blood pressure, and pain level. And I would tell him how it would go about. And once he agrees, I would go back. I would say, okay, I'm going to come back. I'm going to wash my hands and don some gloves. So wash my hands, don some gloves. Before I begin, I check everywhere for safety. So again, I have my gloves on and everything. So first thing for temp, I would have a thermometer. If it's the regular thermometer, it's under the tongue for at least 30 seconds to a minute, I think. Depends which one you get. They also have the ones that most clinics do, where you rub it from ear to ear, from the forehead, go around. Normal temperature is from 97.8 to 99.1. Depends on the guidelines of the facility. So next I will check the pulse, and for this we can use a pulsometer with which most of us have, and this will actually get the respiratory, or I'm sorry, this will get the oxygen levels as well. So after you utilize this on the patient, you would clean this afterwards. So right now my pulse is 71 and my oxygen is at 96%. Normal is from 96 to 100. Okay, and then I'll need to do his or hers blood pressure. In order to that, I'm going to pretend this is an arm. So where it says B is where the brachial is at. So I would align the BP cuff just as it states there, right in between that. And then begin by taking the pulse. Obviously, I'll implement these with the ears pointed towards the nose. And this would be right along, aligned with the brachial. I am dominant right hand, so I'll pump with the right. Pump, 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 pump. Listen, watch. Do that pulse. Hang up my equipment. I'd wash it afterwards, clean it. Then just to verify the pulse, a second way to get that besides this pulse oximeter is I would do the radio pulse, and basically 2 fingers. And while doing that, my left hand would be here doing the radio pulse while I'd be counting the time. But at the same time, I'm gonna check for respiratory rate, which is I'll look for the rising and lowering of the chest. That normal rate is between 12 to 18 breaths per minute. And blood pressure would be 120/80 is the normal. So lastly, before leaving, I would say, do you have any pain? 0 out of 10, 10 being the worst. Anything 6 and above or 7 and above, depends on the facility. Anything 6 or 7 and above is something that does need to be addressed. 5 and below is something that more doesn't need so much invasive stuff. But that's the assessment there. I would clean all the equipment. Once I'm done, I'll put away, clean it. Before I leave, I'd ask the patient, do you have any questions? No? All right, the doctor's gonna be in with you. Before I leave, I check, make sure oxygen is off, make sure the scene's for scene safety, bed's low, rails up. Then take off my gloves, wash my hands, and that's it.